Hopefully, you have participated in the forum discussion on Segment 1. I am anticipating reading many of the potentially interesting posts on the forum discussion board about different healthcare training programs around the world. No matter your background, your viewpoint will help broaden the discussion. Now let's turn our attention to roles and responsibilities. Not only is there a huge breadth of different healthcare professions, but depending on the training received, practice focus, and clinical setting, even within one profession, such as nursing, there's a wide range of roles and responsibilities. Therefore, in order to provide efficient and effective collaborative patient care, it is really important to take the time to learn the roles and responsibilities of the different members of your healthcare team. In this segment, we're going to discuss the breadth of the health professional roles and responsibilities, then describe the depth of roles and responsibilities within one profession, using nursing as an example, and end with a demonstration of how different healthcare providers can efficiently communicate their respective roles and responsibilities using a strategy called Swift Trust. Since there are well over 100 different healthcare professions, we will focus on the roles and responsibilities for some broad categories of healthcare providers who either practice independently or function as part of a healthcare team. Besides the examples of practitioners and specialists that we have just discussed in the previous segments, technicians and assistants are trained to perform procedures, and their education typically lasts between 1 to 2 years. They are required to work under the supervision of technologists or therapists, and examples include pharmacy technicians and medical assistants. The education for therapists and technologists is more intense, lasting between 2 to 5 years, and their responsibilities include evaluating patients, diagnosing conditions, developing treatment plans, mastering procedural skills, and evaluating patients' responses to therapy. Examples include respiratory therapists and cardiovascular technologists. Community health workers are public health advocates who perform community outreach, education, counseling, and support and advocacy. Their training requirements varies across states and typically lasts between 1 to 2 years. Health aides work under the supervision of nurses to provide daily personal care to individuals either in their homes or in long-term care facilities. They receive their training from agencies, facilities, or online. To learn more about these and other healthcare careers, please visit the website listed on this slide. Now let's use the nursing profession to illustrate that even within the same level of training, depending on the clinical setting and practice focus, there can be a wide range of roles and responsibilities. Therefore, it's important to know that not all members of a healthcare profession, such as nursing or social work or pharmacy, all have the same roles and responsibilities. For example, the registered nurse, who is a bedside nurse in a hospital setting, typically oversees patient care, including direct patient assessment and interventions, as well as collaborating with other team members to support care delivery. Alternatively, the registered nurse, who is a case manager, spends most time coordinating patient care among the members of a care team. In order to optimize comprehensive care management, the case manager may be removed from the typical hospital or clinic setting and instead coordinate care from the patient's home in cooperation with the family and a team of care providers. Rick Becker is a current Master's of Nursing student at UCSF in the Health Policy Specialty track. In this video, he describes his roles and responsibilities as a transition of care case manager and the importance of this emerging field with respect to the Affordable Care Act and accountable care organizations.
My role as a transition of care nurse manager with interdisciplinary collaboration is to prevent all-cause 30 and 90-day hospital readmissions. This can be accomplished by focusing healthcare interventions around the patient's main goal and framing the coaching and other interventions around that same goal. At the same time, the patient learns to become more responsible and in control of their own health. So I function as part of a close-knit interdisciplinary team comprised of registered nurses, social workers, and wellness coaches. When a patient is discharged, without a primary care provider, I help the patient connect to a primary care provider for follow-up services. I also make palliative care consultation referrals to the primary care provider and to inpatient case managers. I also make referrals to home health and to social workers so that we can incorporate community resources into the patient's care. Additionally, I perform medication reconciliation, identify discrepancies, and work closely with complex case management programs such as heart failure. My overarching responsibility is to help simultaneously improve the patient's health, ensure high quality patient outcomes, and to reduce healthcare costs. I do that by coordinating medical, social, and community interventions to provide a faster recovery for the patient and improve their health in a community setting. The importance of this emerging field with respect to the Affordable Care Act and accountable care organizations is to ensure high quality continuity of care across settings and facilities. As a result, my role as a transitional care nurse manager and in line with the triple aim, patients benefit from improved discharge plans, reduced hospital readmissions, lessen per capita costs for care, and contributes to the improvement of the health of the community. This focus, this process, incorporates 4 areas that in part overlap, however are mutually important: policy, process, legislation, and infrastructure. Policy drives process and infrastructure, which may involve legislative intervention depending on the health policy aim.
Given all that we have learned about the different roles and responsibilities, what is the best way to determine who is on your team and what is it that they do? In the first module, we learned that mutual trust is central to establishing effective team-based healthcare. Traditionally, mutual trust between team members builds over time through effective communication, articulating clear roles and responsibilities, determining shared goals, and agreeing upon measurable outcomes. But many healthcare settings, such as an emergency department, can't provide the luxury of time for providers to know one another before working together. Additionally, when new teams need to convene and act quickly, or when new members join an established team, trust needs to be established rapidly. This is called swift trust. Swift trust is a strategy for working in a complex system, performing complex interdependent tasks, using the specialized skills of relative strangers. By assuming trust initially and later verifying that members are managing expectations, swift trust allows for the quick starting and functioning of teams. So what are the components for establishing swift trust? Defined role expectations lead to a rapid development of trust and team members' expertise and knowledge. Additionally, all team members are focused on a common objective and are interdependent in the activities performed to achieve the shared goals. And finally, swift trust is conditional and requires the action-oriented reinforcement of members competently performing their duties and displaying professional behavior, such as taking responsibility and being responsive to concerns and issues as they arise. Let's watch a video demonstration of swift trust being established between a transition of care case manager, Rick Becker, and student pharmacist Jennifer Chang in a hospital setting. As you watch the video, think about how effectively the two define their roles and determine their activities to achieve the shared goal of managing the patient's medications.
Come in.
Hi, my name's Jennifer. I'm a fourth-year pharmacy student. I just started my clinical rotation here at UCSF.
Hi, Jennifer. My name's Rick Becker. Nice to meet you. I'm a transition of care nurse manager, and I have a number of post-discharge home visits that I would like to go over with you concerning their medication regimen and the discrepancies that I found.
Great. I'm really looking forward to learning more about how to facilitate a patient's transition back to daily life.
Terrific, because that's exactly what I do. So my role extends from discharge to 30 days post-discharge. The initial part of my role is to meet the patient in the inpatient setting, and then have a home visit within 24 to 48 hours post-discharge in order to evaluate and manage their discharge across settings. So the first patient that I have is a 66-year-old male who was recently discharged after a 5-day inpatient stay at UCSF. The patient was admitted with urinary tract infection and sepsis. The patient also lives at home and is the primary caretaker of his 88-year-old mother. So during my 24-hour post-discharge home visit, I coached the patient to call his primary care provider and pharmacist to answer some medication questions. However, due to today's holiday, the patient received the primary care provider's answering service and the pharmacy was closed. So I requested a pharmacy consult to clarify the patient's questions regarding his medications and the discrepancies that I found.
Okay, I'm happy to help. What's the patient's background?
So I have his history and physical right here. So the patient has a history of atrial flutter, coronary artery disease. He's a diabetic, chronic kidney disease, and high blood pressure. The patient has 2 questions. His first question is about his pain medication. So his discharge paperwork states that he should be taking acetaminophen. However, he wants to know if he can take ibuprofen instead.
That's a great question. So since the patient has chronic kidney disease, he should be taking acetaminophen because it won't affect his renal filtration rate. He shouldn't be taking ibuprofen because it'll affect his kidney and liver function.
Okay, that's what I thought. So thank you for that confirmation. The patient's second question has to do with diabetes medication. The patient's discharge orders state that he should be taking 25 units of Humulin. However, he stated that at his post-discharge endocrinologist visit, his endocrinologist stated that he should be taking 30 units of Humulin.
So it sounds like the confusion here has to do with the mix of input from the patient's physician and his endocrinologist. So I'll take a look at the patient's lab values and get back to you.
Great.
So you also mentioned that the patient is a primary caregiver for his mother, right?
Right.
So I think it would be a good idea if we offered to take a look at his mother's medication regimen since he had a few questions about managing his own medication. Could you please do that during your next follow-up visit?
That is a terrific idea. I'm making it an action item for my next home visit right now, and I will get back to you. Are you ready for our next patient? Mm-hmm. Okay, so our next patient is a 56-year-old female who was recently...
The key learning points for this section are that professional roles and responsibilities depend on the education and training received, practice focus, and clinical setting. Therefore, better collaborative care occurs when we take the time to understand the roles and abilities of the people with whom we work. Swift Trust is a strategy for efficiently determining roles, responsibilities, and shared goals when new members join or new teams form. And now for a forum discussion question. Have you ever been in a situation where the roles and responsibilities of team members were not clearly defined? What problems arose, and what strategies could you use to avoid it happening again in the future?